From Montana's news leader, this is the MTN 9 o'clock news.
Good evening, everyone. Thanks for joining us tonight. I'm Russ Riesinger. A historic day across Yellowstone County and Montana. And finally, a light at the end of the tunnel in the fight against COVID-19. From arrival to dispensing, it didn't take long for local healthcare workers to receive the first round of COVID-19 vaccinations today. This sign of hope as health authorities across Montana did report 29 more deaths related to COVID-19. 15 of those additional deaths are from right here in Yellowstone County. However, Riverstone Health reports this large number is mainly an update of additional deaths between September and December. Several neighboring counties also report deaths today, including Bighorn County, where the death toll has now reached 58. 5 Billings Clinic staff members across the healthcare spectrum received the first Pfizer COVID-19 vaccines today. Q2's Mitch Legge was there to show us how it all unfolded.
Tuesday was truly historic for 5 members of the Billings Clinic staff, who were among some of the first in the entire state of Montana to receive the Pfizer COVID-19 vaccine. Billings Clinic CEO Dr. Scott Elner said that he hopes this is a turning point in the fight against COVID-19. Hospital staff gathered in the Billings Clinic Commons to watch the vaccines be administered. The 5 people receiving it represent different aspects of the healthcare system, with a physician, nurse, respiratory therapist, environmental services staff member, and Billings Fire Department paramedic all receiving the vaccination.
The people here today are true heroes. They're on the front line. They have been exposed to patients with aerosolization of particles of COVID-19, and we want to make sure that they're in the first line to get the vaccine. Billings Clinic received 975 doses of the Pfizer vaccine, with major distribution scheduled to kick off on Thursday. The vaccine will be given out on a voluntary basis to Billings Clinic staff and Billings Fire Department paramedics. Once those vaccines run out, the clinic will have to go to the state to get another allocation, the goal being that eventually the vaccines will make their way to the wider public.
The state is on an allocation schedule, and we'll be able to continue those vaccinations, not only with Billings Clinic, with also the family medicine residency from Riverstone, from our anesthesia partners, and continue to expand that to the community as soon as we have enough allocation available. For healthcare workers that have been putting in extra shifts to care for the high volume of patients, respiratory therapist Michelle Buffington said she hopes the vaccine can help lift their spirits after this year-long fight.
As healthcare providers, we're all just kind of at that point where we're exhausted, and physically, emotionally, it's, and I think everybody's kind of ready to move on. And somebody has to start it. Everything that we've done with our COVID patients has been experimental. There's no definitive way to treat them, so we're kind of always throwing in the kitchen sink and doing what we can, so there has to be something better.
Fire Department paramedic Jason Banfield said his vaccination was just like getting his annual flu shot, and he hopes the new drug will help keep his family and the city he serves healthy.
I think it's important that people kind of lean forward and look at the whole group of our population, and and we need to just take care of each other, and this is one way we can do this.
In 21 days, the 5 people that had the vaccination will have to come back for a second dose of the new drug. In Billings, Mitch Legge, MTN News.
Thanks, Mitch. Now, it's going to take more time for a vaccine to reach rural critical access hospitals in Montana. Many of those hospitals do not have the cold storage required to keep the Pfizer vaccine, and will have to wait for the Moderna vaccine, which can be stored in a standard freezer. Well, those frontline workers getting the Pfizer vaccine are being asked to sit for 30 minutes as providers monitor for signs of any type of allergic reaction. Now, the reaction does not have to do with allergies to food, pollen, or animals. The Centers for Disease Control and Prevention changed course from a previous statement that was made on Sunday, now saying those who experience reactions to injectable drugs can go ahead and get the vaccine, but there could still be normal side effects, including pain, swelling, fever, and headache. Well, healthcare workers at St. Vincent also received the vaccine today, and Governor Steve Bullock was there to watch. Q2's Shaquille Cozart has more.
I'm here at Mansfield Health and Education Center, where Governor Steve Bullock joins St. Vincent Healthcare as they administer the first doses of the COVID-19 vaccine to healthcare workers.
And this really is an historic moment for our state in our country.
Among the first to receive the Pfizer vaccine was an emergency physician for St. Vincent Healthcare, who says it will take several months to a year before a herd immunity can take effect, but the virus will be tackled.
This is my number one wish for the last 9 or 10 months, is to have this moment arrive. When we can finally have something where we can fight this virus before we get it, so that we don't catch it from someone and then spread it to someone. My wife, my kids, my elderly mother-in-law who lives with us, I've been worrying about them every single day since this began.
Second in line to receive the vaccine was the EMS coordinator for the City of Billings Fire Department. He says that being vaccinated not only protects himself, but the people he serves as well.
It's not just important for you, me, or everybody in the community. It's important for the world so that we can get this pandemic stopped and we can go back to a little bit of life as normal. Having the ability to get back to a little bit of normalcy would be awesome, and if it means getting a little pinprick in the arm, I'm all for it.
Governor Steve Bullock says he does plan on getting the Pfizer vaccine when it becomes available, according to the vaccine plan that is still being developed. He says that right now, healthcare workers and first responders are the priority. Bullock also says that when the vaccine becomes widely available, it will help to mitigate the effects COVID-19 has had on everyone.
In addition to continuing with the mask wearing and the social distancing and the washing, that we really need to get folks, once availability is there, to get this vaccine. That's the way we're going to make sure that our schools and our economy stay open, that our healthcare facilities aren't stressed. So take a breath, have some patience. There's still more to do before we get our hands around this, but know that we're heading in the right direction.
In Billings, I'm Shaquille Cozart with MTN News.
Thanks, Shaquille. The Montana VA healthcare system could receive its first doses of COVID-19 vaccine just in time for Christmas. Due to the rural nature of the state, the Montana VA will receive doses of the Moderna vaccine once it's approved by the FDA, hopefully later this week. Now, the first people vaccinated through the VA will be frontline workers in the intensive care unit, medical surgical unit, and emergency department. Staff believes they'll be able to roll out the vaccine to their assisted care facilities at the same time as the rest of the community. Staff says it's no secret that they've been hit hard by the pandemic, but this news is bringing a ray of light.
Well, one of the hardest things that we've had to deal with throughout the COVID times is fear and anxiety. With the vaccine, I'm hearing the words hopeful. I'm hearing terms that we see the light at the end of the tunnel.
I would say we're all very excited and hoping, since Moderna is the one that we will be getting, that it is approved and we do receive it early next week.
Vaccinations will be completely voluntary, and veterans who have questions are asked to contact their primary care provider directly. More details released today as a 17-year-old Billings boy accused of shooting and killing a 17-year-old girl pleads not guilty to felony deliberate homicide. That shooting happened December 6th at a home in the 800 block of Wyoming Avenue. Police found the victim in a bedroom with a gunshot wound to the head, apparently from a stolen .45 caliber pistol. Now, court documents reveal while drinking with some friends, Xavier Charles allegedly pointed the gun at the girl. When she jokingly said he wouldn't do it, he did. Police say Charles asked to be placed in handcuffs and told officers several times that he had killed the girl. Charles, who is charged as an adult, is being held at a youth detention center on a $500,000 bond. Well, when COVID-19 hit Montana back in March, live music venues were the first to shut down and likely will be the last to fully reopen. The financial fallout has crushed both venue owners and the artists they book. Without stages to play, local musicians have had to adapt, find new ways to stay in front of their audience and earn a living. Tonight, Q2's Paul Humphrey checks in with a popular Montana duo to find out how they managed to record, promote, and release their new album.
That fear, that anxiety of what's next, all around a microbe. But when you have a fear about your economic living being blasted, wow.
For musicians Josh Keir and John McClellan, the pandemic year of 2020 has been one of a different rhythm.
Originally, there was, kind of a little bit of a panic mode that set in and things.
The plan for this year was to release their new studio album, Ghosts Go West, by early this summer.
It was pretty arbitrary thinking back about it now, but in our minds, and at least in mine for sure, and I was kind of pressing him, that we wanted this out like July 1st.
But then the pandemic hit and the music stopped. But the shutdown wasn't all bad.
COVID actually helped us, right? So it gave us more time. It gave us more time to go through the songs.
It was really cool to be able to step back and go, dude, let's just take our time. No one's pressuring us. It's just this internal pressure that we're men, we work hard, we take care of things. No, you're not, dude. You're human. You got to step back and rest like everybody else.
The project is definitely better because of the more time that we got because of this.
Extra time in the studio was great, but
anybody who knows El Wencho knows that we want to play live, period. We need people.
Facebook Garage gigs, complete with a virtual tip jar, got the band's music to their fans.
The first time we set up and played, it was the two of us in his garage. We played to a piece of sheetrock on the wall. We were sweating. We were like so into it. We didn't care if there was 3 people watching us. It was the most bizarre thing. And we'd get done. We did like 6 songs in a row, like a normal, complete El Wencho show. And we got done, and we were just like sweating, and there's just silence. And I was like, this is so bizarre, but it was so fun.
Craft Local Billings, this one's for them.
Wanting to give back, the band split their virtual tip jar with the venues they would have been playing. That fast-tracked the band's community initiative. And now,
we're going to take a percentage of our net every show, merch sales, whatever it is, and we're going to put that aside. And what we want to do is I don't know the exact money amount it's going to be, but we're going to do a yearly scholarship.
2 Montana music makers with a message of unity, setting the tone to survive the pandemic, proving that when the tone is right, the tune is good. In Billings, Paul Humphrey, MTN News.
Thanks, Paul. And when the Big Sky State fully reopens, the band hopes to play a full slate of spring and summer shows. Still ahead on the MTN 9 o'clock news here on the CW, Yellowstone National Park opens its gates to snowmobiles and snow coaches this morning. We'll tell you what you need to know and heading up to the park. But first, a warm-up is on the horizon. Bob's in next with your full 7-day forecast.